This morning on today's checklist, we're going to break down some common and sometimes confusing medical terms.
Yeah, here to prepare us for our next appointment is board-certified surgeon Dr. Cedrek McFadden. Good morning. Great to see you as always. We were just talking about, we love this idea because this is something that I think a lot of us are confused by, might not even realize it. Yeah. Let's jump in with two terms here, infection versus inflammation.
Yeah, so definitely, let's help the people here, right?
Yeah.
So infection refers to a problem that started from a bacteria, a virus, or some other germ, right? When you have inflammation, we're now talking about the body's response to that infection, or maybe the body's response to an injury or some type of irritation. And the challenge that many people have is that you don't realize that one of the reasons why we overprescribe antibiotics is because inflammation is often confused for an infection. Just because something is red or swollen or painful, it doesn't mean infection's present. You know, I'm from South Carolina, Craig's from Carolina. He knows that in the spring and the fall, allergies are awful. And you can have congested noses, you can have red eyes, but there's no infection that's present. So what we do in our office when we're trying to decide if someone actually has an infection, we need to look beyond just the way it looks, beyond the way that someone may have more pain, and look for real signs of infection.
Let's talk about testing here for a moment, because there's a difference between a diagnostic test and a screening test. But again, I don't think a lot of folks realize what the difference between the two is.
Yeah, the difference, Craig, really comes down to why you're doing the test, right? A screening test is done before symptoms appear, and a diagnostic test is done after we've realized there's a problem and now we're looking for answers. And a test can be both screening and diagnostic, like a colonoscopy mammogram, but it's the intent behind it that makes the difference. So a colonoscopy, if you're 45, you're overall feeling well, you're going to have a screening colonoscopy. But if you've had bleeding or some of the other problems we've talked about on the show, that's now a diagnostic. And the reason why this is important is because once symptoms appear, our focus goes beyond prevention, and now we're looking for a cause. We got to do the digging to figure out what's happening that's creating those symptoms.
Doctor, these next two we hear all the time, allergy and side effect. People may think they know, but do they really know?
This is my favorite. This is my absolute favorite because, you know, when we think about, let's start with side effects. Is at the bottom first. Side effects are those sort of unwanted but expected effects of a medication. An allergy is your immune system's response or reaction to that medication itself. So we see people all the time, they'll have medications listed as an allergy when in fact it's not an allergy. So you have side effects from like your pain medicines, drowsiness, right? You're taking antibiotics, you may have GI upset. These are not allergies. When you have allergies, you're having things like hives. You may have some swelling. There could be some wheezing or trouble breathing. Those, in fact, are very important. And so I think it's very important because if you have limited yourself from certain medications, you may have fewer treatment options in the future. And so anybody who's having this, I always say, be open to the conversation with your doctor to say, you know, maybe I didn't have an allergy, and ask them to take that off of your medical list because, again, that may limit things moving forward.
Oh, that's a really good point. Okay, all right, what about infectious versus contagious?
Yeah, so we've talked about infection a little bit before related to germs. Contagious kind of refers to the ability to spread from one person to another. You know, we've talked about COVID and the flu, and those things can be both infectious and contagious, but it's not the same thing. Think about problems like tetanus, right? Or stomach ulcers, which you may not know, many of those are bacterial type infections that start stomach ulcers. And as a result of that, they are infectious, but we don't think about sitting next to someone and catching their stomach ulcer. That's just not the way it works, right? So there are different terms, and a clear way of thinking about it is an infection basically says where it came from. Contagious means kind of how it spreads.
Let's end with a really important one here. Benign versus malignant.
Yes, so very important. In my world, this means a lot. You know, benign kind of, obviously you think of non-cancerous. Malignant means it's cancerous, it can grow, it can spread to other areas. But the misnomer that many people have is if something is benign, that it's harmless. And I've taken care of many patients that have a benign process that causes either pain or bleeding or blockages because of where it's located. So they're not the exact same thing. An easy way to think about this is that the name primarily just says where it's from, but what it's doing is actually a completely different thing. So don't confuse those two, but very important.
Dr. McFadden, great stuff there. Thank you so much. I learned a lot. For more commonly misunderstood medical terms, you can head to today.com.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.